Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Hi, good afternoon. This is actually Dr. Jennifer Sims. Welcome you to Dr. Tom Roselle Live. Dr. Sims, excuse me, that's me. Dr. Roselle is on vacation with his family today. And in our studio, I have Dr. Stephanie Pina with me. And we're going to be talking about fertility and infertility and all the causes of those things. If you have any questions about what we're talking about or any other questions that concern a different approach to your health, please give us a call at 888-630-9625. So, Dr. Pina, Stephanie.
Good morning.
It's good afternoon. I used to always say that, too. Let's talk about the lecture you're going to be giving in our office this Wednesday, June 27th, on fertility. What are some of the things that you think that you're going to touch on or would be interest to our listeners this afternoon?
Sure. Infertility and fertility in general when it comes to women's health has become a major issue over the years. More and more women are pushing back the times that they want to think about having a child, and they're noticing that they're seeing more and more problems with that. And essentially that can be because of a number of different reasons. It could be structurally, it could be emotionally, and there are also biochemical issues like we always talk about with any issue that's going on in the body. But essentially with fertility and infertility, a lot of it has to do with getting that woman ready for basically the next biggest step of her life. And if she's not ready for it, that might give us some issues. So during the lecture on Wednesday, I'm going to sit down and kind of break down some of the basic information that women should really know about their cycles, about getting pregnant, about the things they might run into, whether or not they're doing a natural route or they're actually going through, say, an IVF clinic or using kind of drug-stimulating hormones, because there is a time and place for all of those, and essentially the more information you know, the more options you're going to have as well.
Let me ask you this. Is infertility a problem that's only related to women? Because when we think about it, we always think about the woman not being able to conceive, not able to get pregnant, multiple miscarriages, those type of things. Does it affect men? Do men have anything to do with this process?
Well, you know, they always say it takes two to tango, so it absolutely does. And unfortunately, women tend to be the ones that end up going through most of the treatments and stuff because they're the one that's going to be carrying the child. It's been recommended that, or suggested that about 35% of infertility issues have to deal with a cause that's related to a woman's reproductive cycle. 35% is also related to a men's cycle. From there's some additional causes, and about 10% is still an unknown factor. They don't really have a known cause. But when it comes down to the male factor, you have to also think about how genetics are going to play into it too, and essentially how from everything from sperm motility to numbers to essentially making sure the environment's right on for both genders, how that's going to play out as far as how fertile a couple is.
Okay, so you just touched on the sperm count going down. Let's just go back to females and their egg counts. You and I were having this really interesting discussion on the way over here about how many eggs we actually have as females. You want to touch on that?
Sure. The numbers get really interested because as females, we are born with a certain number of eggs. And that's why when people talk about age and how that's affecting their fertility, it really has to do with the fact that once we're born, we already have the amount of eggs we're totally going to produce. Versus in men, they're constantly producing sperm the whole time. So that works out well because of genetics, but essentially with females, we actually start up as a fetus, we have 7 million eggs that are being produced. So those are smaller cells. By the time we're born, that's already down to 2 million, so there's been a dramatic drop. So you're even thinking before you're even born, there's already been some changes in your body. And essentially by the time we go into menstruation, you're really looking at about 400 eggs that are going to be possible throughout your whole fertile cycle that are possible for getting pregnant and actually conceiving. So there's a lot of numbers that are being thrown out there as far as how do you essentially make those eggs the best possible eggs as possible. And really that has to do a lot with lifestyle and factors and looking at stress and all the things that we like to look at as far as with natural conception as well.
Right, and lifestyle factors, we can't underestimate that or talk enough about that on this program. Dr. Roselle talks about this constantly, and those would be things like our toxic level exposures, our diet, the chemicals that we have had in our bodies, the vaccines that we've put in, where we've lived over time. You know, depending on where you live, you have different chemical exposures, and all of those things really do affect your health, and your health has to do with being healthy enough and your body being able to conceive. Having said that, how common, in your opinion, is infertility? When we talk about this, typically we're always thinking of the woman who's much older, right? When I say much older, that's subjective because I am approaching 40, and I'm not much older yet. However, you know what I'm saying as far as you're talking about the amount of eggs that we have when we're a fetus, a baby, really statistically what that comes down to. How common is infertility?
Fertility can be pretty common. You can see couples up about 30% having troubles with fertility issues, and that might range from whether they're a younger couple, basically someone in even their 20s, all the way up to about into their 40s, and nowadays even to their 50s. In fact, there was a record where someone, I believe she was in her 60s, she's in India, where she actually was able to conceive. Now, when we look at from a natural life cycle, you know, is that supposed to be technically possible? No, and she did indeed get help from fertility sources as well. But essentially, it is pretty common because there's a lot of different factors involved with it, and it would be easy to just say if you change one thing or you use this one drug or you eat one certain type of diet that everything would change, but it doesn't really happen that way. It's a mixture of different things. And just like with everything else, environment and genetics have a lot to do with it. When you're looking at pregnancy in itself, a lot of pregnancies, even though they go through a regular conception cycle, what's going to happen is that they'll be miscarried or essentially have genetic issues as well them too. So as a woman gets older, we see more and more people going to, say, in IVF clinics and fertilities places, because essentially their chances of having viable eggs and conceiving are getting smaller and smaller. Their chances are just a little bit less likely. So you see more people in, we'll say, older ranges, the end of their menstrual cycles and their fertile years, basically going in for more IVF, where at younger ages you have more viable eggs. So essentially you're going to have an increased chance of getting pregnant on your own.
Let me ask you this. So what is really considered infertility? If you've been trying 6 months, is that and not being able to conceive without using contraception? Is it a year? Is it 2 years? You know, when is it that a couple should really realize that, hey, maybe we are having a challenge?
Well, definitely the main definition that's out there right now is that a couple that's still considered in their fertile years are not able to conceive without contraception basically within a year. As your age increases, so usually they'll start to make a little bit of a barrier after about 35 years of age. After 35 years of age, if you're not able to conceive after 6 months, then they're suggesting going to see a fertility specialist and start looking at what are your hormones doing? Are your eggs still viable? Are you still ovulating? For the men, it also means that looking at sperm quality, what factors and lifestyle factors such as alcohol, drugs, medications could possibly affecting essentially that fertility cycle. So there's a lot of issues to be determined no matter what age you are. So a lot of women come in at different ages throughout their cycle. I've known some 20-year-olds that have come in and we've worked with, and then I've known some 40-year-olds that we've come in and worked with, and they've both been able to identify some of their reasons of why they've been infertile. This is where using Western science and more natural science basically work hand in hand, because they're able to kind of help figure out what's going wrong with things, and then we're able to kind of figure out how much of a change we can make.
Now, when we're talking about women's health, fertility, infertility, how much do hormonal imbalances play into that? For example, a woman who's got endometriosis or polycystic ovarian syndrome, you know, does that really make a difference in if they're able to get pregnant?
Absolutely. Endometriosis, which is essentially the lining of the uterus, has gone into other areas of the body and essentially create patches, so it does have a hormonal effect. And we know PCOS is polycystic ovarian syndrome. Essentially, there's numerous cyst formations that are happening on the ovary, so there's not one main ovulated follicle that's able to go through ovulation. Both of those are all under hormone control. In fact, they're not just under the control of the reproductive hormones, but they're also under the control of things like estrogen. Well, estrogen would be one, but insulin and also testosterone, which we normally, especially with a female, don't think as much as has to do with fertility issues. So there's a lot of hormone control, and everything's happening in that master gland, the hypothalamus, the pituitary gland, and there are numerous hormones that are going on there. So even if there's an issue, say, car accident, head trauma, there might be an issue at the highest source where those hormones aren't even being produced, or they're being produced in the wrong levels, that are going to affect everything down the cycle later on, even down to the egg follicle and the sperm.
How much does taking birth control pills, synthetic hormones, having other hormone imbalances play into this? Even thyroid imbalances, do they have an effect?
Absolutely. And when you think about it, especially with the increased use of contraceptions and using birth control pills, you're giving yourself some of the same hormones that you would need to monitor a cycle with. What you're doing is you're just giving it an abnormal amount so that you are really in control of the cycle versus leaving things up to chance. When you look at that, a lot of women, when you ask them, when they come off of birth control, they notice that their cycle takes a really long time to go back to normal. The body's become dependent on those hormones coming from the outside sources, so essentially they don't know how to produce their own hormones, and it can take numerous cycles. I know someone who took 6 months for her body to get back to normal. And in fact, we also know that some of these medications do affect other hormones like thyroid issues. High thyroid and low thyroid can affect fertility in a major way.
To just touch a little bit more on hormones, we know that there's 120 side effects, if you will, of just taking simple birth control pills. We know also, when we've talked about on other programs about hormone replacement, which is a different population, but still it's the same synthetic hormones that are used in synthetic HRT as well as birth control pills. And we know that can increase your risk for heart disease and other problems, significant problems as well. So something to consider if you are on birth control, thinking about getting pregnant, thinking about getting on birth control or not from a synthetic form. Things that definitely I'm sure you're going to touch on this Wednesday, June 27th, in our office at 7:30 p.m. You can hear more from Dr. Pina talking about this great topic of fertility. If you're interested and you would like to come, it is free. However, you do need to call our office to reserve a seat because we have limited seating. It's 703-698 7117, 703-698-7117. So having said that, Dr. Pina, let's touch on, because I know this is not your main focus, but let's just touch on before we go to a break here in a couple minutes, some of the things that a woman's body has to go through to do the IVF and the traditional fertility treatments.
Well, when you're looking at traditional fertility treatments, essentially what's the main important thing is really regulating how those ovaries are being formed, or the ovarian follicles are being formed. They're going to be released and create eggs. When you look at that, the cycle is going to be the main thing. So a lot of the drugs and medications that they're going to do first may help regulate the cycle. Then you're going to look at basically stimulating more follicle production so that essentially you're able to produce more and more eggs that might be viable. From there, depending on what kind of fertility treatment you tend to have, especially when you're talking about IVF, they're going to look at collection, getting the eggs so they can actually make an embryo in basically a petri dish and then re-put it back into the body. And with that insertion, it's going to improve your chances of basically getting pregnant because you're kind of taking some of that side steps out. So there's a number of different fertility types of treatments that essentially, depending on all the factors that are going to why that particular couple may be infertile, that can work for the person. But any way you look at it, natural things that you can do, whether it's diet, lifestyle, even in my case, giving acupuncture, what it can do is increase your ability's chance to essentially have a better quality egg and a better quality pregnancy as well, too. Because even though we always think about the conception part of this and getting the egg implanted, we have to also think about what happens with that pregnancy afterwards.
Fertility treatments as well. Are there natural ways to do fertility? Is that something that you're going to discuss in your class on Wednesday?
Absolutely. A main thing has to involve getting the woman, basically, and the man, knowing the cycles of what's going on. If they can understand their body better and they understand how things are going, then that's going to make it much easier for them.
Okay, great. Don't leave us. We'll be back in just a few minutes after a few commercials.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Hi, we're back with Dr. Tom Roselle Live's radio show without Dr. Tom Roselle. It's Dr. Jennifer Sims here sitting in for him with Dr. Stephanie Pina, and we're talking this afternoon about fertility, infertility, female hormones, a little bit on male hormones and cycles. Dr. Pina is giving a great lecture on this topic on Wednesday, June 27th, in our office at 7:30 p.m. Our phone number is 703-698-7117. If you'd like to call and reserve a seat, seating is limited. The lectures are always free, but we don't have a live chair. So please, if you're interested, go ahead and give us a call. Okay, Dr. Pina, we're back. So let's talk a little bit about, I'm going to veer away from infertility, but a little bit about hormones. So we know that most young girls are menstruating, unfortunately, too early, in my opinion, much younger than they used to, and there's a lot of reasons for that. So let's go through a little bit of the cycle of a female and what her hormones look like, and also how does that affect her fertility or chances of infertility?
Well, essentially, what's going to happen is that you do have rises in estrogen at the beginning of a cycle, right after someone bleeds or has their period, and essentially that's going to help to trigger not only the uterine lining to start to become more nourishing and develop, but also it's going to help with embryo growth, ovary growth of the eggs themselves. And essentially, halfway through the cycle, the eggs themselves are going to be released, and that's when progesterone starts to take over. So a lot of times when you see different types of birth controls out there, there's going to be mixtures of ones that have more progesterone, more estrogen. So there's a fluctuation of a number of different hormones in the system, and also triggers that feed back through the system to basically tell us if we need to produce more or produce less. So we're seeing the younger and younger girls going through menstruation earlier. Essentially, that means those hormones are kicking in a lot earlier than they're supposed to, and there may be some outside factors that are essentially causing some of those triggers to happen that we have to look out for.
Now, one of these triggers, one of the things that can cause imbalances in the system, and we talk about our toxic exposures, and we actually have a phone call. Laura from Great Falls, who has a question, it looks like about genetically modified foods. Laura, can you hear us?
Yeah.
Hi.
Hi, how are you? Thanks for taking my call. I am concerned about the GMO-containing foods that consumers eat, and they don't know. I know in England, I travel to London a lot, and in the UK it has been banned a long time ago. And I don't know, the United States still permits this to go on and on, especially with the BT toxin, especially in the corn, and people don't know. And my question is whether Virginia is one of the states that requires producers or companies to label their products and put, this label as GMO containing, because this changes the DNA, and one of the problems that we have is reproductive problems, which is associated with the BT toxin.
Laura, Laura, I'm going to answer your question the best I can because we don't have a lot of time before we have to go to break. Okay, so for GMO foods, absolutely, that's a perfect tie-in to toxic exposures. To one of my huge pet peeves, you're right, most people are not educated. Genetically modified foods are basically frankenfoods. They're not foods. We cannot break them down. The studies that are coming out are showing how you're absolutely right, they can change the DNA. If anybody's really interested about this topic and the details of what we can do, how it's affecting our genetics, how it's affecting our children, and not just our children now, but future populations, Jeffrey Smith is the guru on this topic. I cannot remember the name of his book, but if you Google Jeffrey Smith, you will get all of the information that you need and then some on this. And as far as your question really quick on labeling, there's a lot of debate, right, Stephanie? There's a lot of petitions and things going out about how our foods are labeled, not with just genetically modified foods, but even with free-range foods that are fed, animals that are fed hormones. So these are all great things that lead into why we're so unhealthy and why we can't just do something natural like have a baby, right? It's the simple things. So we're going to stop here for some news, and we will be back shortly after the break.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back to Dr. Tom Roselle Live. This is Dr. Jennifer Sims sitting in for Dr. Tom Roselle, and I'm here with Dr. Stephanie Pina, and today, for this afternoon, we're talking about fertility cycles, infertility, and the lecture that she is giving in our office this Wednesday, June 27th at 7:30 p.m. It is free, but seating is limited, so we do ask that you call 703-698-7117 to reserve your seat. As with all of our lectures, we do give continuing education free lectures on several topics pretty much twice a month throughout the year, which lead up to our huge event. This year it's in October instead of September. It's going to be on October 20th. And Stephanie, Dr. Pina, do you want to talk a little bit about that before we move on?
Sure. This is something we've seen you guys there before. It's called Ageless Health 2012. It's basically we're going to talk about how to live well and prosper in a stressful world. This is over going to be at the Fairview Park Marriott in Falls Church. It is on Saturdays, October 20th. And essentially, it's a full day of listening to all the speakers that you hear on Dr. Tom Roselle Live Show. Dr. Tom Roselle's there, Dr. Jennifer Sims is there, myself, and the other chiropractors that you hear around here as well are all speaking on that day. And essentially, it's a nice connection to kind of learn about what you can do for your own health and well-being. How essentially do you start making those changes, and when do you make that decision according to where you are in your life now, where your health can be in the future. So it's going to go over everything from distinguishing health and wellness and the emotional sides of healing to how we are energetic overall and how to eat well on the run, and also covering a lot of the common diseases and origins that we think of for diabetes, heart disease, and how bodily injury can be affected. So this is a great day. It's very informative, not only for the patients and people that come in to listen to it, but also for us doctors as well that are presenting, because you get to hear a lot of different aspects that only make your practice and our practice better, and also allow you that chance to learn a little bit more about your health and well-being. So if you're interested in coming and joining us on that day, essentially you can call the office at 703-698-7117 to sign up. And then you can also look at some more information right off of our website, which is rosellecare.com. So that's www.rosellecare.com. So a lot of the information is going to be there. It's a great day, and that kind of is the emphasis of when we all do these little lectures, how essentially it gets brought together in one big lecture, and you get to meet and greet with us as well.
Great. Well, I hope that we have a great turnout like we've had in the past. It's just so much information. It's overwhelming. I think you definitely leave there with a lot of practical suggestions that you can use in your day-to-day life. Let's get back to the topic. We were talking about infertility, fertility. We were talking about the normal life cycle of a female. What are some things that we can do to test to see if we even have a problem or where the problem is?
Well, the greatest thing, when I talk to patients, and they're looking at what can I do without going in to see a doctor, or how do I know if I'm going to be fertile or if I'm even cycling correctly, because a regular menstruation period where it's either long or it's not coming, that's going to be a main key issue there. If we don't know what's going on with your body, then it's going to make it more and more difficult no matter what type of treatment you decide to do. The first step is basically something that you can do really easily at home, as simple as taking your temperature in the morning. It's known as basal body temperatures, and there's a way of actually charting it. And nowadays with modern technology, there's an app that you can even do to chart it as well and tell you exactly when you're supposed to have your period. But essentially what it's doing is looking for temperature changes that can happen throughout the cycle, where as we basically ovulate and towards the second half of the cycle, the temperatures usually go up about a fifth of a degree or so. It's not a huge change, so you have to monitor over a couple of different cycle periods. in order to really see the trends. But that will kind of help to monitor and see what's going on and help doctors also analyze what's going on with your hormones as well, because the hormones that we talked about earlier are essentially playing into what goes on with temperature changes. Other things as far as looking at cervical mucus, also looking at different kind of premenstrual symptoms that you normally have that would be predictors of a cycle that's coming up. A lot of the signs and symptoms that a woman gets used to related to her cycle can actually give us a lot of information about what's going on, and then we can use that to help start treating as well.
Just to touch on that a little bit too, there are a lot of great natural family planning ways to do this as well. The Creighton method, the traditional natural family planning, like you said, checking cervical mucus, taking temperatures. As aside to that, we know that doing basal temperature for thyroid imbalance also is useful, because that's a really good clinical way. Actually, it's really free, cheap home way, right?
Exactly.
Just to measure your temperature. Are you running a temperature that's really low? Are you lower than 98.6 most of the time? And honestly, most of the women that I have them chart their temperatures, they are low. If our metabolism isn't working well, how can other things be working well? So there are so many things that you can do before you even get to the doctor's office, before you even get your blood drawn, and do saliva testing and all of these things that we do. But there are definite things that you can do proactively. And I like also the way you touched on the hormonal, the PMS type of symptoms that so many people get. They can be a huge clue into what's going on. So I'm a chiropractor, so I know what I would do if a patient came in to see me who was having this issue. Obviously, I would adjust their spine, which would increase their cerebral spinal fluid flow, which would help how their brain works, how their hypothalamus and pineal gland work, which are these things in your brain that actually affect your hormone balance. So I know, you know me, anything I can get my hands on, I'll adjust it. How does acupuncture help with fertility?
Well, it's very interesting. When you break down how acupuncture and Chinese medicine, which can also involve some dietary recommendations, it also can involve Chinese herbs when they're given at the right times. Essentially what it's doing is increasing blood flow and oxygen flow. So in the case of someone who's coming in, first of all, with an irregular cycle, which may even be, if they're earlier in their years and they're looking to become pregnant, or it could be if they're coming in with an irregular cycle where essentially they're going into premenopausal phase, or even they're wondering, are they in menopause? Essentially what you want to do is kind of help to regulate out that cycle and see what's going on. But acupuncture, by increasing blood flow basically to the uterus, can help out in a number of different ways. There's been plenty of studies out there that essentially have shown that acupuncture done to help regulate out the cycle. It's also been done to basically help right before a couple goes into the IVF clinics for egg transfer, and also when egg retrieval, or even if they're already on doing a hormone cycle, it can kind of help some of the side effects that some of the large stimulant dose hormones are basically kind of providing. So it can be used along with or together, or separate, I should say, from some of the other traditional sources. So what it's doing is improving the blood flow that's going to the uterus, helping to improve and balance out those hormones. And it's also, the good thing is that if you think about it, a lot of times when you have couples that are going in fertility, they're also not thinking about one of the major things that might be making them infertile to begin with, and that's the stress response. A lot of people go in and the pressure is really on to get pregnant. They want to have that child so they can, it fits into their life plan. So stress becomes a major figure in how the body responds. And we know that the hormones, cortisol, can definitely affect the hormone response, even the reproductive hormone response. So essentially, acupuncture is also great for even just de-stressing the couple, and that can work for both genders, male and female. So even if they're just coming in to relax and they're getting anxious about doing any kind of procedures, they can come in and get that done, and it's going to overall help out with quality of that cycle versus some of the drugs and the procedures are really looking for quantity. So there's some definite differences where Chinese medicine works in favor of the couple versus the way the drugs or fertility treatments, a more conventional style, would too.
I'm going to go backwards a little bit about something that you said about the stress response. We do know that major hormones are produced in the ovaries. Every fat cell makes them. I know it's kind of a bummer. And our adrenal glands, those stress glands, those little kidney-shaped glands that look like little kidney beans that sit on top of your kidneys, and they're designed for fight or flight. And you mentioned cortisol, that stress hormone. It's so powerful. If we are even perceiving stress, we know that it has a direct impact on our immune function. There's a direct correlation between stress, perception of stress, and immune function. And we see that. We can actually chart that. You can actually measure that with testing. Also, the adrenal glands, since they are a major producing site of hormone, guess what? They make estrogen, progesterone, and testosterone. So if you're living a life of stress, either being in a job that you don't like, or in a relationship that's not healthy, or whatever it is for you, guess what? Your body thinks it's in a jungle, a lion is chasing it, and is that really the best time to conceive?
That'd be no.
That would be a no, an emphatic no. It wouldn't be. So please take into account what Dr. Pina is saying is it's not just about a sperm and an egg getting together and making a baby. There are so many other factors that, unfortunately, probably 15, 20, 30, 40, 50 years ago, we didn't have all of these other outside issues with toxins and stress and exposures that we have coming in that bombard the adrenal glands and create that whole cascade. And I know Dr. Roselle is constantly talking about this, but it is important to address your personal life and how that affects everything. So to get back to acupuncture, you mentioned herbs. Are herbs, are they as effective as these major drugs that people get on to help with fertility?
Well, obviously with the Chinese herbs, they're working a little bit different than the way that the fertility drugs are working. Obviously, fertility drugs are much stronger. They're there really to stimulate the body. They're there to kind of put the system into overdrive. And essentially, other ones are also in there to basically help produce more hormones on their own. So you can have someone who wants to go through a natural cycle who maybe just uses some of the main drugs in there to help stimulate the production of more eggs and follicles, and then for the rest of it they are able to get pregnant on their own. But with herbs themselves, they tend to be a little bit more longer acting. The cycle in Chinese medicine is broken up into 4 different parts, a little bit, and there's some characteristics that carry over between the follicular phase and the luteal phase that we think of in conventional medicine. But the herbs in Chinese medicine really get broken down based on where you are in that cycle. So a real vague way of saying it is that almost every week you're changing up because the body is basically changing itself. At some point you want to actually promote more blood flow, so you use herbs and use a diet and do exercises that are essentially going to promote blood flow that's going to help out with the uterus. Another part, basically, you'd want to make sure that you're using herbs that can kind of help get the person in the best state possible for that ovulation. And towards the end of the cycle, if you're trying to maintain, you might look at something that similar looks like increasing of progesterone that basically can be like a pregnancy maintenance hormone. If they don't become pregnant and then you're working for that next cycle, you want to make sure that essentially all that old blood is removed and that the uterus is in the best shape possible for the next cycle as well. So a lot of times when patients come in, I usually say it's going to take a number of cycles to basically kind of get that body response up and going. I've had plenty of people come in and the first time around they end up getting pregnant. But if you're using herbs and more natural methods, you want the body to basically correct itself. Most of the time it didn't become off balance just overnight. So the same way as if you correct it more naturally, it's going to take a little bit more time, but it's mostly going to maintain that way as well too.
And that's really an important thing to note. Everybody wants that quick fix with everything, and why wouldn't it be different with getting pregnant? It did take a while for your body to get so out of balance, for whatever reason that is, to not be able to conceive naturally. So it will take time, and I think it's really important for people to understand that when they're going through the process. There's this false idea, even within in vitro treatments, that, the first time we're going to get pregnant. And it's really emotional. Unfortunately, I've seen some really good marriages be destroyed just from the stress of infertility. So it's a very serious issue, but you have to go into it knowing that it is a process. Time is important. Perception of stress does matter. It will affect how receptive the body is to any treatment, being a drug treatment or a non-drug treatment like you're offering here. Let me ask you this. When it comes to what people put in their body, does it matter? I mean, is it something that you recommend to your patients, a specific, not a pregnancy diet, I will say, but, are there things or recommendations that can be made? Is it okay to be trying to get pregnant and be drinking diet soda? Is it okay to be, doing things like going to McDonald's for lunch? Does that matter?
There are things as far as getting pregnant and essentially maintaining a pregnancy that can be used. Obviously, you're looking at a good anti-inflammatory diet, so things high with antioxidants. There's been studies that show more of a vegetarian type of diet also during those pregnancy months can actually work for the best because you're decreasing the inflammation. Your body's not having to work as hard to get rid of some of those toxins. So I think we're going to come back to that in just a couple of minutes, and we'll see you after this break.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Hi, this is Dr. Jennifer Sims sitting in for Dr. Tom Roselle today. So, Dr. Pina, if you could wrap up what you are going to be talking about this Wednesday in our office, June 27th at 7:30 p.m., give us a little bit of a synopsis about your lecture.
Sure. We're going to be talking about fertility and infertility and essentially going through some of the basic information that can be evolved with both natural treatments and also some of the popular treatments that are out there now and how the two of them can be fit together. We know that there's increasing growth for fertility studies and also for treatments because even in 2009 there was 441 fertility clinics out there in the U.S. alone. So what we're going to really do is talk about how would you use some of the things that you do on your own naturally to basically improve your chances of becoming fertile. How would you basically change your lifestyle and essentially what kind of treatments you can do from everything from acupuncture to herbs to diet to nutrition to essentially figure out how to make yourself better, make a better quality type of conception and pregnancy, and even from there going on through the pregnancy cycle too. Once you get pregnant, that doesn't mean it's over. So essentially we're going to be talking about a lot of that information, answering questions, and hopefully you'll be joining me, and everyone's invited. Even if you know someone who is thinking about getting pregnant, that works as well too. So hopefully we'll see you there.
Well, great. If you have any questions, please give our office a call at 703-698-7117. Don't forget to follow us on Facebook at Roselle Center for Healing, or if you have any other questions, you're welcome to email us at rosellecare.com. That's our website, and there's also a link to our Facebook page. Remember to listen to Dr. Tom Roselle live every Sunday at noon. This is Dr. Jennifer Sims. Thanks for listening today, and have a great day.
Did you know that maintaining a total state of wellness is a choice? That you have total and absolute control over anything that happens to your health and wellness? This is Dr. Tom Roselle, author of Ageless Health 101, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. A state of total wellness is your choice. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program. It will show you how your decisions can lead you to a life without impairment. You're in control. Health is a Do-It-Yourself Program.
Health is a Do-It-Yourself Program. Ageless Health 101. Available in paperback and CD. Featuring 3 easy-to-listen-to and follow-along CDs with bonus music selections Finding Peace and Change is Beauty. For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Suffering from chronic health problems? Tired of taking dangerous drugs? This is Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me on Saturday, October 20th for my Ageless Health Seminar, How to Live Well and Prosper in a Stressful World. And I'll show you how to increase the quality of your health and length of your life. Saturday, October the 20th at the Fairview Park Marriott Hotel, Falls Church, Virginia. Seating is going fast. Don't be left out. Register today at rosellecare.com or by calling 703-698-7117. Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.